Yes.
All right, Lagos, it is 16 minutes gone past 5, and you are tuned in to Smooth Health here on Smooth 98.1, where we love music, we love life, and we love talking about your health. And today's not going to be any different because today we're going to be talking about something that indeed resonates with women. And when I say women, yes, the 8th of this month is International Women's Day, but in honor of that, we decided, you know what, on Smooth Health today, we'll be talking about the woman and her body. Everything you need to know, all those interesting questions that you've always had. Uh, Sometimes some of them are so perplexing for you that you don't even know where and how it started. But having this conversation with me is Dr. Ayeni Omotayo Mofoluwake. She is a gynecologist at Iwosan Lagoon Hospital. Good evening. Good to have you with me.
Thank you very much. I'm happy to be here.
Glad to have you. Lagos, you can chime in as well. You have questions. Hey, it's not only about the ladies, the men as well, because you have women in your lives. Trust me, you want to be in here. You want to ask those questions that you're probably not sure about. You've been trying to figure out certain things. You hear she's cramping. How? What does that even mean? Okay, if that's the case, what exactly happens when a woman is pregnant? So many questions, and sometimes it feels like very few answers. But well, I have Dr. Ayeni here to at least weigh in and share her thoughts today on the conversation. And for those who are wondering, yes, you can join us on YouTube as well. That is youtube.com/slash smooth 981 FM Lagos. And you can also catch all the live happenings there as well. All right. I am a woman. Yes. But sometimes certain things are just perplexing, even for me. But I know that sometimes a woman goes through so many changes from puberty to pregnancy, even menopause, and they're like, how did I even get here? But for me, the most important question I would like to weigh in and ask is, what's the most important thing every woman should know about her body at different stages in life?
Okay, so the stages of a woman's reproductive life is um, categorized into maiden stage,
Okay.
then the mother stage, then the stage. So you
Mhm.
have the maiden stage, that's when you are young.
Okay.
That is when we actually have the teenagers, the pre-pubertal girls, but let's just go for the ones that are maybe majority of this audience, which will be the maiden stage, the mother stage, and the sage stage. So the
All
maiden
right.
stage is the period before you get married. So
Mm.
that's the period that the woman is beautiful, she's young, she's vivacious, she's
Right.
glamorous, she's having the time of her life, especially those are girls that are in the universities and the ones that are just graduated. So the
All right.
mother stage is the stage of people who have children or who are pregnant. Then the
Okay.
sage stage is the stage of women who are in perimenopause or in actual menopause. So for
Right.
the ones in the sage stage, the
Mm.
disorders that they can experience can be usually menstrual disorders
Mm.
that they usually experience. Some people may actually have bleeding disorders. That's why we call them menstrual disorders. Some people may have problems with not seeing menses or seeing too much menses. So those are the concerns. So you should actually keep a menstrual calendar. Usually look at your
Okay.
symptoms during your menses. Then also
Mm.
this is the stage that they're actually adventurous. So that's the stage you
Mm.
can enjoy yourself and have fun. But the consequences in future life is there. So we talk about sexually transmitted infections. We talk about vaccination, especially against human papilloma virus, because the
Right.
risk of having human papilloma virus, which is the precursor to cervical cancer in about 90% of cases, just one sexual exposure is 46%. So you may be considering immunization. Then also we talk of preconceptional care. That is the care that we give to women before they actually go into pregnancy to prepare them for motherhood and enhance their chances of fertility. So
Mm.
they consider something like that so that you can be screened to look for complications that can affect the good pregnancy outcome in you. For the
Hmm.
mother stage, that's the stage of pregnancy. So that one involves getting pregnant, complications that may be associated with pregnancy. Some
Right.
people are not even pregnant, but they are looking for childbirth, they are looking for conception, but
Indeed.
they are married, so fertility issues. So, and that is the stage that you may have fibroids growing. That one would also lead to menstrual disorders. So
Mm.
a good screening
Mm-hmm.
or trying to see your gynecologist every time, using
All
a
right.
very good hospital, having the knowledge about your body during pregnancy, having the right knowledge about pregnancy is very paramount. Then the sixth stage is the menopausal symptoms. Trust me, it can be very turbulent in some people. So
Oh,
the
wow.
symptoms that comes with it, the depression, some people lose their relationships, some people lose their self worth, some people they become depressed, some people they are not just in fact some people will even think something is wrong with them. The doctors are not getting what it is. So that is what is important for everybody to know that we have
Mm.
stages. So let's look at this age range. So before the maiden stage, you have the age of 18 to like 25 years. For
Right.
the for the same the mother stage, you have like 25 years to 35 years. So some people will say 40 years. So for the
Okay.
perimenopause, we start from 40 years to 55 years. So when
Mm.
you are in that age range, know which group you belong to and what to
Okay.
do. Thank you.
Mm. Interesting indeed. There's something you even made reference to, and I'm even itching to get into that question, and really has to do with how often should a woman see her gynecologist? Some people would say, oh, going to the gynecologist is only when there is something absolutely wrong with you. So it's not something that you should be going. Why are you frequenting the hospital? Are you sure that everything is right with you? But really, what how often should a woman visit her gynecologist, and what are some routine tests or screenings that they need to get through? Because sometimes you just hear, oh, okay, it's only when they know about, some people only know about breast cancer, cervical cancer. That's the only time they'll say, oh, okay, go for screening for this or that. Aside that, there's no other reason why they want to go see the gynecologist to check anything wrong with them. But it's only maybe when they have headaches, they will now say, okay, or maybe when their periods are not aligning, they're trying to get pregnant, that's only when they go to the gynecologist. How often should a woman see a gynecologist?
So for a woman should actually see doctors. Minimum should be at least once in a year. But when we are
Okay.
talking about gynecologists, it also depends on what are the problems. So all women should see doctors at least once in a year. But
All
now
right.
if you have some peculiar issues, then it increases your visits to the hospital. Now,
Mm,
for the women that are in the young reproductive age group, some people
right.
have severe menstrual pains. They will say, oh, it is normal. But it can be a signal that there's endometriosis. Endometriosis is when you have the lining of the womb that is shed or that bleeds. When you have it outside the endometrial cavity, and usually it's in the ovaries. So it is when some people go to the hospital
Routine
that they say, oh,
checks.
they have endometriosis, and that time it
Mm,
would have advanced, and it is a very common cause of infertility. Some people is when they go to the clinic that they discover that they'll just say I have small pain that they discover that they have
mm,
ovarian cyst. Ovarian cyst can occur that is cancerous, can occur in young age. So we have a stream of age. We have the extreme of young age. We have a extreme of older age. There's a lot of people that they don't even know they have a cyst. So you need to see a gynecologist at least once a year to do a scan for you to see what is there, what is happening to you. Then we talk about cervical cancer screening.
All right.
Cervical cancer is the commonest gynecological cancer worldwide, especially in sub-Saharan Africa. Is the
All right.
commonest in sub-Saharan Africa. So,
Mm.
and the service can be assessed without any invasive test. It can be subjected to cytological evaluation, apart from the
All right.
vaccination. So, from the age of 21, that is what the screening modality advise. And because the reason why they put at 21 is that, okay, they assume that maybe you have your first sexual exposure at the age of 21. But if you
Mm.
had your first sexual exposure before the age of 21, you are supposed to screen earlier. Because one of
Okay.
the risk factors to developing cervical cancer is having sex less than 18 years. So
Mm.
that you should actually go for screening because of that human papilloma virus. So that one, it is advised that when you do it once and it is negative, depending on the type that you have done. We have the one
All
that you
right.
have to repeat every 2 years. That one we call that one conventional pap smear. We have the one that you repeat every 3 years. That one we call it liquid-based cytology pap smear. We have the one that we do every five years. That one we do liquid-based cytology with human papilloma virus. That virus that causes cancer, you go for the screening. And that one you don't need to repeat it every 5 years. So you give yourself that one as a gift. But you as a woman, you have fibroids. You are supposed to see your doctor at least twice in a year. One,
Mm.
to assess the size of the fibroids, to
Okay.
assess it is not giving complications. And I hope people know that fibroid can actually become cancerous. It can be a precursor to cancer. So you need
Okay.
to, especially the women who are in the older age group from 40 years, you need to go
Hmm.
and be sure that there's no cancerous transformation of these cancer cells. Because trust me, a lot of technology has improved. It has made us to see that, okay, there's some fibroids, I would say that they are actually fibroids, actually have
Okay.
some form of cancers in them. So a woman is supposed to, depending on the pathology you have, minimum is at least once a year for complete evaluation. They call it health assessment. So, but if you now have a health gynecological condition, depending on your gynecologist, but for fibroids, at least 6 months. For endometriosis, you are supposed to also be checking ovarian cysts to know how it grows for you to be evaluated. We now talk about the breast. Breasts are usually managed by general surgeons in Nigeria.
All right.
But you see, you can still see your gynecologist to do breast examination, especially if you have a family history of breast cancer. You have family history of breast cancer, then we talk of something that is carries in the gene. We call it BRCA1, BRCA2. That is the gene. So you need to go for screening and be sure that you are not at risk. And you need to go for it from the age of, for people who have family history, from the age of 30 years, you're supposed to go for yearly mammogram. Some people don't even do mammogram because it's of the radioactive, ions. But you can do breast
Okay.
scan. Breast scan
Okay.
is minimal radiation. So you just do a breast scan to be sure that there is no lump or anything growing. For
All
some
right.
people, you have family history, your men, the males in the family used to have colorectal cancer. The risk for the female is
Hmm.
endometrial cancer, breast cancer. So for that kind of person, the person should have at least twice yearly a pelvic scan to check the organs to be sure that there's no endometrial cancer growing. So for somebody who has breast pathology before, any
Mm-hmm.
breast problem, the first place they go to is the ovaries. You want to check your ovaries and be sure that nothing is growing there. So it depends on what you have, what is the issue, what you need to monitor. But minimum once a year.
Hmm. Ooh, interesting conversation we're having this evening on Smooth Health. And if you just tuned in, Lagos, well, you can share your thoughts as well. Today we're talking about the woman and her body. Well, you have a woman in your life, probably your girlfriend, your wife, your sister, your mother. And having this knowledge is also beneficial. You get to understand her better. Probably she's having mood swings and you're wondering, "Huh, what is this one again? What did I do?" Well, these are things you need to come through and find out. And I have my guest virtually in the studio, virtually, same. I have Dr. Ayeni Omotayo Mofoluwake with me. She's a gynecologist at Iwosan Lagoon Hospital. And we are talking about this. If you have questions, you have, contributions you want to share as well, what you can do is come through on WhatsApp. The number is 0809 4440 981. Let's have your thoughts, and she'll do her best to address them as we journey along. However, let's take this quick breather, Lagos. On the other side, we've got more questions to get into. Well, talking about those CRAPs, PCOS, endometriosis, and all the likes that some people usually are scared of talking about. We'll delve into that more so. Menopause. Some don't even want to, it's like a forbidding thing people don't even want to touch. We'll touch on some of those and more. But Lagos, let's take this quick breather. Don't go nowhere. Stay tuned to Smooth 98.1.
Drive. This is Smooth Health on the Drive.
Quick, very, very quick, and we'll be back in.
No problem. No problem.
Enjoy a great creamy taste with Dano Cool Cream and Dano Cool Cow Evaporated Milk. Try it and taste the Dano difference.
This is Smooth Health on the Drive. This is Smooth Health on the Drive.
Lagos, it is 32 minutes gone past 5, and you're tuned into Smooth Health here on Smooth 98.1. My name is Joy Uri, and if you're just tuned in, well, you've missed a bit. I won't say so much, but you've missed a bit. And today we're talking about the woman and her body. And my guest this evening is Dr. Ayeni Omotayo Mofoluwake. She is a gynecologist at Iwosan Lagoon Hospital, and she is shedding light on what women need to know about their bodies, as well as the men in their lives, and all the things that they can do to help these women, because hey, we can do everything all on our own. Yes, I know sometimes we carry the pregnancy, but you also can help when it comes to that. But talking about things women experience, I know we've touched a bit on menstrual cramp, heavy bleeding, endometriosis, fibroids, and the likes. But I want to ask, what could be the cause of this? I know you've touched a bit on saying that some of them could also be caused by family it could be the genes in our family, so we need to be watchful and mindful of that. But what other things could be the reasons behind this? While some people are experiencing irregular menstruation or even very heavy bleeding, some say that they don't even bleed for 6 months at a stretch, and they're like, okay, I'm fine. Are they really fine?
Okay, so that would take me to discuss the normal menstrual cycle. So when you understand the normal, you know what is abnormal. So normal menstrual cycle should be 21 to 35 days. Less than 21 days abnormal, more than 35 days abnormal. So a lot of people say, Dr. Ayeni, oh, I was sick like 28 days before. Now it's 26 days. Now it's 24 days. It is normal. Because when you are younger, you'll be seeing your menses at a longer period, maybe like 30 days, 32 days. But as you grow older, it shortens. Then when you are going through the perimenopause again, it elongates, just like that what do you call it, pre-reproductive age, then it ceases completely. So 21 to 35 days is the normal. So far it is between those days, which is normal. Now the cycle length is 2 to 7 days. Less than 2 days abnormal. More than 7 days abnormal. Some people say, oh, Dr. I just menstruate for 2 days. It is normal.
Okay.
So far it is between that 2 days. It's 2 to 7 days. Less than 2 days, then you should be concerned. More than 7 days, you should be concerned. Then we talk about the volume. the average should be 30 mils. That's 10 mils syringe, 3 of it throughout your period is normal. So people say, oh, anyway, it's very scanty. They want you to be rushing. Yeah. No, it is normal. So it's actually 20 to 80 mils. So imagine that 10 mil syringe or the 20 mil syringe, just that throughout your menstrual period. It is
You're
normal.
fine.
So don't panic. Don't think something is wrong. Some people say, Dr. My menses is just all black. Oh, it is the bright red. Then because your body is producing the chemicals that is stopping you from bleeding excessively. That is why it's like that. Not that you have a pathology. So that the people that have fibroids, it will be bright red, they'll be bleeding, yeah. So that one is an abnormality.
All right.
So when you now have volume more than 20, 80 mils, 8 of that 10 mil syringe, then it is abnormal.
You should be worried.
Then when it's less than that 20 mil, you should be worried. It's abnormal. So once you know that, now let's look at these disorders. Let's look at PCOS. PCOS is polycystic ovarian disease. It's actually an endocrinological condition. It is we call it autosomal dominant. That means it controls the entire body of the person. That means the person must have inherited a gene from the father, inherited a gene from the mother for it to manifest in the person. So it comes with infertility. It comes with abnormal menstrual period. And the menses will cease for like 3 months or more. Some people say, I've not menstruated for in 3 years, 2 years, 6 months. That's abnormality.
That's
Instead of menstruation, yes, 21 to 35 days. Once more than 35 days, you need to seek help. And about it, PCOS is not just about I want to see my period, though. It's not about I want to have children, no. Now, because it is PCOS, and because the endometrial lining is just growing uncontrollably, people who have PCOS have the risk of developing endometrial cancer. That is what we are afraid of in that person. And that is why the person must shed off their endometrium every month to prevent that cancer. Now, they also have risk of developing diabetes in pregnancy, diabetes in the future, if it is not well managed. So, because the background to the theory of PCOS is abnormal glucose metabolism. So, you need to go to the hospital for you to be well investigated. Say, oh, I'm enjoying period free. Any likes it will come. No, the future consequences you should look at. Now, let's talk about endometriosis. I've mentioned endometriosis before. It is when the lining of the womb is outside the cavity. In about 60 to 70% of cases, it's in the ovaries. So it gives pain. Why? Because the ovary is an ovoid structure. It doesn't have an outlet. So you see that medicine that comes out, that accumulates in the ovaries without an outlet. So the ovaries balloon out. And that's why you're having a pain. As it's filling up, there will be pain. And as it progresses, that's why the pain increases more and more. And that is why it is non-stop. That we call it chronic pelvic pain. Now, as the ovary becomes so big, it bursts. Because like a balloon, it bursts. And when the fluid inside leaks, that is what causes additions. This structure will be joined to order. Everything will be joined to order. And it restores the normal anatomy of that place. And that's what leads to infertility. That leads to what we call frozen pelvis. That's what leads to the can't even operate the person. So that is endometriosis. His own hallmark is pain. So for fibroids, what we really know about it is that it runs in the family.
Right.
It is carried in our genes. It's a problem of the black race. That's why it is us that knows how to manage it. So we carry it in our genes. So it's our problem. It's a black man's problem. So when you gather 100 women, 80 to 90 of them will have fibroids in different sizes. So it's not if you have fibroids, it's not only you are not alone. A lot of people that you're not talking, they have fibroids. So some people it's because they are obese. Some people it's because they've not had children. Some people it's because they have too much estrogen in their system. There are so many things that causes it. Some people it's their diet. So that causes endometriosis. But irrespective of what is the cause, they have solution. All you need to do is to seek help with somebody who knows what to do, and you'll be all right.
I like what you just said. Somebody who knows what to do, and you'll be all right. So it is not enough for you to just sit back, fold your hand, and say, if people hear, what would they say? Go to the doctor. Ask well, they're in the better position to help you out with whatever you're going through, as opposed to hiding it and keeping it. It did not happen to my mother. If I go and talk now, they will say maybe village people, in quote, are after me. No, there's no village person after you. Certain things can skip a generation, but don't wait for it to get to you, your born kids as well, before you start to take action. And that's why I'm enjoying this conversation, and I'm sure that Lagos is as well. Well, Tinu has a question here, and Tinu says, is there a list of all the things we need to check for? And is there where we can also download them so we know how to get access or know when to go to the hospital, how to go about them? Because women go through a lot.
Okay. So for gynecology, you need to check your reproductive organs. So what are your reproductive organs? Your breast, your
Okay.
ovaries, your tubes, your uterus, your cervix, and your vagina. Those are your reproductive system. The other one that controls these things in the brain. So, but the one that you can check. So, how can you check these things? You can do breast scan. If your family history, you can do mammogram.
Okay.
If it is the pelvic organs, you can do a pelvic scan. For people who are older than 40, say transvaginal scan, that one that they will go through the vagina. That's one that is the best for you because it can show you clearly. Because the probe stays on the organ, it shows whatever is there clearly because it sees what is in the pelvis more than what is in the abdomen because fats and bladder interface with the vision of the radiologist. So you check all those things, and if they say everything is smooth, then you are good to go. At least you do that yearly. For the other organs in the body, it is the hormone estradiol that is produced in the reproductive age group that controls all the function in the body of the woman. And that is why when the woman is going to menopause, she experiences problem because of
Mm.
waning ovarian function, waning estradiol levels. So you need to check it controls your heart, your brain, your lungs, everything it controls it. So as you are growing older, you check everything and be sure everything is in good shape. And that's why when the woman is growing older, that's when she's predisposed to cardiac diseases, she's prone to gastrointestinal problems, she's prone to cancers, you need to screen everywhere. As once you are more than 40, at least give yourself as a birthday gift to go for the
Yearly,
screening at
right?
least once a year. And there are many
Mm.
facilities that run it. And we are happy. It was some wellness at the job. We won't even keep you waiting. We will give you excellent services. You will be fun. You will enjoy yourself and you'll be happy that you came to us.
Right.
We will treat you very well because our mantra is to look after you. So you can visit us at Iwosan Wellness and you'll be happy that you came.
I like that. Okay, I know that we're almost running out of time, but if I do not touch on this one, I'm sure Lagos will not forgive me. And has to do with, I was going to talk about pregnancy, but I think I'll leave that one. We've touched a bit on the things that can affect women and how that, can, if you go to the gynecologist, if you go to your doctor, they will now direct you what to do. But this time around, this one that affects a lot of women, and I say a lot of women because sometimes you hear, I just went to pee, and I have collected so and so and so. And then you hear people selling all manner of things in the name of treating urinary tract infections. Oh, they'll tell you it's Staphylococcus aureus. And mentioning an array of other things that could affect a woman. Now, let's talk about the urinary tract infections, which are UTIs. Sometimes it could be mild and it could just get offensive. Sometimes ladies have yeast infection, bacterial vaginosis, and the list is endless. Sometimes it even affects, reproductive organs, as has, research has actually shown. But how can women reduce the risk of having these infections, and when should they seek medical attention?
So the urinary tract infection is actually the calling or the specialty of neurologists.
Right,
But
right.
for you all start as a gynecologist, you see them often, especially it happens in pregnancy and also outside pregnancy. Why are women prone to recurrent urinary tract infection? That's the first question. The
Okay.
reason is because the organ that gives us urine is also at the same place where the vagina is,
Right.
where your rectum is, in the same hole. So bacteria can come from the rectum and
Mm-hmm.
come into the vagina and cause a problem, or come from the vagina into the urethra and cause a urinary tract infection, come from the rectum and cause a vagina infection.
Mm.
So we also talk about what we call the normal
Okay.
flora of an organ, especially the urethra, the rectum, and the vagina, are the
Mm.
normal soldiers that guard that place. So they are the one when you culture them, they are normal flora there. It's not that there
Mm.
is a problem with them. They are the ones that are guarding, so that the ones, the Boko Haram, the kidnappers, they will not come and invade the place. So that
Okay.
is exactly what they do. So it's not that they are
Mm.
pathogenic. So when we see some, they say, okay, this is culture's Klebsiella, is culture's staphylococcus, we'll just be laughing. The reason is because staphylococcus is part of your normal skin flora. It's a normal skin
Okay.
commensal. So if you don't collect the urine sample in the right way, it also causes
Mm.
problem. So what are the things that make a woman to be prone to urinary tract infection? Hygiene, cleaning from the back to the front. You
Mm.
bring the bacteria to that place. Some people, they don't clean very well when they even urinate or when they clean. Then some people, sexual activity, some people, their beddings are not so neat. I know our men, it's not that they wash their stuff before they come in, they just come in straight like that. So if they carry it from their beddings, they just enter and just infect the woman as just they go. And some people will just be coming in, going out, coming in, going out, just trying to enjoy themselves. And they come in, they carry more and push it to the woman. I know.
Oof.
Then a lot of them, they don't, as they are trying to even attach their stuff, they will be grouping around. They will put it in the anus, put it in the urethra before they find the hole. So they carry bacteria from everywhere and just infecting the woman. So
Oh my word.
that is one of the very, very common cause of that
Mm.
thing. Of that is. Then another thing is that as the woman ages, the flora changes.
Okay.
When you are young, it's a different flora. When you are in the reproductive age group, it's a different flora. As you are changing to the perimenopausal period, that's why a lot of people who are around their 40s to 50s, they have issues with this thing because they are in the
Mm.
perimenopausal period. The flora changes. When you are in menopause, it changes again. So as it's changing, you may have some issues with each. Then some people
Mm.
they take antibiotics for a very long time. And the antibiotics does not say, okay, it's only the God, they want it to work. Well, it has globally. And it kills all these soldiers. And that's why it's allowing Boko Haram to come in. And the Boko Haram in this instance is the
In infections.
vaginal candidiasis because it
Right.
comes when the immunity is low, and that's why pregnant women also have it all the time. So
Mm.
what you need to do is that when you have it, go and see your doctor, let them
Right.
identify the cause of the thing, treat it very well for you before it can have
Gets
a bad
out of
impact.
hand.
Because trust me, it can actually cause chronic renal failure if it is not treated well.
Oof. Mm. Well, I definitely want to say a very big thank you for shedding all this light this evening. I wish we could go on and on. There's so many questions that's still coming through I want to get across to, but as they say, time is never our friend. So how can Lagos get across to you? What social media platform can they reach out to you to get more insights? Because I see some questions. Some people are shy to ask, but they want to get more answers from you. How can they reach out to you and ask their questions directly?
So I actually work as the head of Hops and Gynae Lagoon Hospitals. So we have a lot of gynecologists. I'm not the only one. I'm
Right.
just representing our hospital today. And all our consultants are excellent. They can provide you excellent services. You'll be happy you visited us. So we
Mm.
have branches at Bodilon, Ikoyi. We have at Illegally, Iron Clinic in Illegally on Mondays. Our mother and child hospital is actually at Ikeja. We run clinics in Ikeja throughout the week. We also run clinics in our wellness center at Idejo. So, uh, so that is what we do. And our social media handle is Lagoon Hospitals NG. That's
Lagoon,
our, yes, Instagram
Lagoon
account.
Hospitals
And
NG.
yes, so you
All
can get
right.
across to us there.
Mm. Thank you so much for all that insight you shared this evening. And please, I know that I dragged you out of the operation room, so I'm sure that you're itching to get back in. Thank you for all that you do, and thank you for your time.
Thank you very much. Thank you.
All right. Lagos, we've had an insightful session this evening. As always, on Smooth Health, we never stop talking about your health, whether you being a man or a woman. It's all about our health and making sure that we are in tip-top shape. And today we're talking about the woman and her body. And we had as our guest, Dr. Ayeni Omotayo Mofoluwake. She is a gynecologist at Iwosan Lagoon Hospital. Thank you so much as well, Lagos, for coming through and sharing your thoughts. Well, as always, we have more lined up for you. So, stay tuned to 98.1.
Every Thursday at